Meet Evan Hirschauer, local scholar athlete, senior at Edmund Burke, lettering in 4 sports, all while maintaining straight A's and a member of the Beta Club. Today we'll tell you Evan's story of how he became a patient at Burke Medical Center after tearing his meniscus playing football, and how therapy got him back on track doing what he loves.
I tore my meniscus in my left knee in a football game, and I planted and moved laterally and tore it. Well, I came in here and met Corey, and he compared my hurt knee to my healthy knee, and gave me a few exercises to do at home, and we did some in here. It's in town, it's local, and convenient for me. They were very knowledgeable of what they were doing. The exercises he has me doing really work my knee, and it's really helping me. I don't think so. The whole facility is really good, and they really know how to treat you right. Well, therapy is like a workout, and if you want to improve yourself in a better way, and you really like to work out, then yeah, I consider it fun.
While Evan begins therapy, we'll hear from his therapist.
My name's Corey Munsell, and I'm a physical therapist here at Burke Medical Center. So Evan came to us after surgery for his meniscus. He tore his meniscus while playing football, and he had a meniscus surgery, and then he was coming here for rehab after that. So for Evan, it's been just kind of a process of pain limiting him and things he's not able to do. So we set up a plan for him to get back to going to play football and track, and we've kind of progressed like as he comes in, and working with him and seeing his goals for like each treatment and what we want to work on to help him get back to doing what he needs to be doing. So. Yeah, so the process for each patient is a little different when it comes to coming up with a plan. The big thing is the goals. So they come in the first day, we see what's going on and like what they're limited and what they can't do and what their goals are for physical therapy, and trying to find something that we can work towards for them getting back to doing. And then it's just a process from there of setting up visits, and then come in and see how they're doing and kind of progress like as tolerated to those goals. Yeah, so I think that's always the thing with physical therapy is like we got to remember we have a person in front of us and not just a patient, and empathy is a big thing for me personally, and I think as most PTs will tell you, we don't do it for us, we do it for the patient. And we've all been there. Most of us have had an injury or something that we couldn't do and wanted to get back to doing. So it's just really important to just kind of step back and realize that this is a person and not just a patient or a referral from a doctor. My favorite thing about working with patients is getting to see them, get back to doing what they love to do. It's great for them to come in like every time and say, hey, I'm feeling better, or like my pain's not as bad. But the best thing about it is them coming in that day and saying, hey, like I could stand up and clean the dishes today, and I couldn't do that 2 weeks ago, or I can go out for a walk that I haven't been able to do in a couple months. And that's the most exciting thing, I think, as a physical therapist for me. I think the big thing is the compassion of the care that you get, like the level of compassion. It does feel like a small town, like everybody knows everybody, kind of family feel to it. And I think that's important because some of the places around in like other areas, you walk into a clinic and there's 7,000 people in there, and you can't really relate with anybody, and it just feels like you're just another number in the books. And here it feels like you're actually an individual, and we care about you, we care about your story and your life and what's going on, not just you as a patient. I think the big thing that kind of draws people here that I would say, rather than going to like a bigger place in Augusta, is again just that compassionate care that you get and that small town feel. Like, we care for you as a person, whereas some of the bigger name companies might just, you know, push numbers, or you're just another patient that they can get scheduled to make money. You definitely have that more compassionate feel here versus other places in like Augusta. The last visit's always like exciting and sad at the same time, because the cool thing about physical therapy is you get to build that relationship. You're seeing someone for potentially a couple months at a time, or maybe even up to a year, depending on what's going on. So you really build a connection with them, and like that last day is exciting because you know they're back to doing what they need to do and can kind of manage things on their own. But it's also sad at the same time, because like you built a friendship or a relationship with that person, and now you're sending them off on graduation day to go back and live their lives. So it's a pretty exciting day.
And what an exciting day it'll be when Evan Hirschauer's therapy comes to an end and he's able to return full force to the sports that he so dearly loves. Thank you, Evan, for choosing Burke Medical Center for your physical therapy journey. We wish you the best of luck in all of your future endeavors.